Okay, so we're talking carnitine. We're talking heart disease. One of the all-time great nutritional supplements for heart disease is carnitine, L-carnitine. There's different forms of carnitine. We'll be getting to that here in a little bit. Carnitine is not just important for the heart. It's important for the brain as well. It's important for the liver. It's important for a lot of things. But if you're dealing with cardiomyopathy, heart disease, in my opinion, L-carnitine is a must-have supplement. L-carnitine is an energy shuttle. We said yesterday how it shuttles fats into the little structures inside a cell where fat is burnt, the so-called mitochondria. And if you have heart disease, this is a supplement you want to know about. This is a supplement you want to be using. If you have heart disease, the chances are pretty good that if you go into the mainstream realm of cardiovascular medicine, you're going to get a drug that dumbs down your heart. This is a major pharmacomedical strategy for dealing with heart disease. For over 200 years, this has been the way doctors have dealt with heart disease, dumbing down the heart. One of the first heart drugs was an herb called foxglove. Foxglove is a really beautiful purple plant. Got the Latin name digitalis purpura, technically, purple digitalis. If you have cardiomyopathy, probably digitalis sounds familiar. Digitalis is a source of a medicine called digoxin, brand name Lenoxin, and it works by blocking the heart, blocking electrolytes that go into the heart. Electrolytes run the heart, electrically run the heart. The heart's an electrical system, and it depends on electrolytes. Electrolytes, as you can tell from the name, are little electrical pieces of minerals. Electrolytes, potassium, calcium, sodium, magnesium, are little chunks of electricity, and they drive the heart. They get fed into heart cells. Lenoxin works by blocking this movement. Does anybody out there think that's a good idea? Your heart cells work by the movement of electrical energy into the heart. That's the way it's supposed to work. So the pharmacomedical model, in its brilliance, has created a drug that stops that from happening. Who thinks that's a good idea? It's not a good idea. It's an awful idea. And maybe you need it temporarily. I don't even know if that's the case, but let's say you need it temporarily. The last thing you ever want to do is be on this kind of poisonous substance for life, and people are on it for life. By blocking the electrical energy into a heart, you get a decrease in heart rate, you get an increase in blood pressure, and doctors think that's a good idea because you get more blood to the tissues. And this is why every year Americans spend nearly $50 million on digoxin and Lenoxin. Not good, not smart, bad medicine, bad science, in my humble opinion. Do you need drugs sometimes? Do you need to block the movement of electrolytes in the heart if your heart is diseased? Well, maybe, but not forever. The job of a healthcare professional is to make sure you get off your drugs, not to get you on your drugs. The job of a healthcare professional should be to make sure you're not doing poison, not that you're on poison. Do you need it sometimes? Maybe. I'm not even sure if you need it sometimes. Let's say maybe. But you certainly don't need it for life. Another awful type of drug that victims of heart disease and the victims of the pharmacomedical model, and I use that word advisedly, victims of the pharmacomedical model will be subjected to, is a class of drugs called beta blockers. Metoprolol, propranolol, atenolol, olol. When you hear olol at the end of a word, or at the end of a drug name, you've got a beta blocker. Olol, metoprolol, propranolol, atenolol, and as the name implies, beta blockers act to block the heart. They block specifically the beta nervous system. The beta nervous system runs the heart, among other things in the body. The beta nervous system drives heart electricity. So guess what? The pharmacomedical model, in its infinite wisdom, has created a drug that blocks the beta nervous system, that blocks the heart, that shuts down or slows down electrical energy in the heart. Calcium channel blockers, diltiazem, Norvasc, verapamil, they do the same thing. This is lunacy. This is utter lunacy, and we just take it for granted that we got to be on our drugs. And I am a registered pharmacist, and I've studied these things for 30 years. It is lunacy, medical stupidity of the highest degree, in my humble opinion. Yes, I know you need them sometimes, by the way, so don't attack me on that. But to stay on these things. All right, I'm Pharmacist Ben. You're listening to The Bright Side. We'll be back after this. We're talking heart disease, cardiovascular disease, and cardiovascular drugs. We said beta blockers and calcium channel blockers and digoxin, just dumb down the heart. Very poor pharmacomedical strategy, in my opinion, although perhaps necessary occasionally for short periods of time. Then you come to the statin drugs. Oh, my God, what a scamola that is. Over 70% of heart disease patients are taking statin drugs. In fact, according to the Harvard Medical School, nearly 25%, 1 in 4 Americans are on a statin drug. That is astounding. How could 1 in 4 people be taking a prescription drug? And even more shocking, according to the United States government, the Center for Disease Control, the CDC, in a document titled Prevalence of Cholesterol Treatment Eligibility and Medical Use Among Adults, in this document they state that nearly half of Americans whose cholesterol readings, whatever that means, puts them at higher risk of heart attacks are not taking medication to drive down that risk. And according to the CDC, this represents, quote, a clear opportunity. Yes, opportunity, this is what they call it, a clear opportunity, unquote, for more intensive efforts to advise patients to take medication. They want you on drugs. They see the fact that only 25% of Americans are on drugs. They see that as an opportunity to convince the other 75%. I mean, it's not funny, but it is. It's tragic. Statin drugs are awful. Although you wouldn't know it because they're gently awful. The average dose of a statin drug is, say, 40 milligrams a day, right? All right, so you might get some muscle weakness, you might get some liver problems, but it's not going to kill you. But if you were just to up the dose a little bit, you'd be dead. And by a little bit, I'd say maybe 10 times. Take 500 milligrams, or 400 or 500 milligrams. If you're not dead, you'd be very, very sick. This idea of taking drugs when we don't need them, it's a very recent phenomena, maybe the last 50 years. This idea of taking drugs for risk management. Nobody even talks about this. We don't even think about this. We're taking drugs not because we're sick, but just in case. Now, who do you think that benefits? To have people take drugs just in case, to reduce the risk. These are just-in-case medicines. We're taking them even when we're healthy. And we've only been doing this for a while. This is a relatively new strategy. Think about this. Millions and millions, many millions, tens of millions of Americans, healthy Americans, are taking poisons to somehow keep themselves from getting sick, just in case, and they're paying top dollar for it, either via their insurance companies and insurance premiums or directly. And when I say top dollar, I really mean top dollar. I'm talking hundreds of dollars a month for these things. And you know how much they cost to make? Pennies. Literally. Pennies. The bottle costs more than the stuff inside it. The pill costs more than the medicine inside the pill. The excipients and the tableting agents and the marketing. Oh, the marketing. That's where most of the money goes. And we're paying for that. We're subsidizing that. And when I call these things poison, I am talking literally poison. If you take just a little bit more of your drug, say for a tenth of a teaspoonful a day of Zocor, you would be dead, or at least very sick. You cannot poison the cholesterol. You cannot poison anything in the body, but the cholesterol production machinery, and it is biochemical machinery. The cholesterol production machinery is incredibly important, and cholesterol is incredibly important. Unspeakably important. And I know I've said it a lot, but I'll say it again. If you wanted to poison a culture, if you wanted to destroy the health of a culture, a very good strategy would be to put everybody on a statin drug. It is the only healthcare professional who could ever suggest or recommend that somebody took a statin drug is a healthcare professional who does not deeply understand pharmacology and the nature of it. The idea of chronically poisoning any part of the body, especially the heart or the liver in the case of statin drugs, in the name of our health or preventing disease in the name of just in case, is just unspeakably dumb. On the other hand, the health benefits, the heart health benefits, the overall benefits of carnitine. Now, they're not well known by doctors maybe, but we've known about it for decades. I first heard about it in pharmacy school. Carnitine was first recognized for its energizing benefits, or its energizing heart benefits, back in the 1930s. Health researchers in the early part of the 20th century were starting to get a little concerned because heart disease was becoming epidemic. Heart disease was really nobody really got heart disease until the early 1900s. Heart disease rates started to increase, and by 1920, 1930, 1940, it was becoming alarmingly concerning. Doctors were like, what the heck is going on here? Why are people dropping dead of heart attacks all of a sudden at such an epic rate? Somewhere around the 1940s or 1950s, heart disease became the leading cause of death, and it was relatively unknown. Now, I wonder, looking back, hindsight being 2020, could it have been anything about the grains? Could it have been anything about the processed foods? Could it have anything to do with our fast-paced lifestyle? Could it have anything to do with fats and trans fats and hydrogenated fats? Could it have anything to do with government recommendations of eating? Well, I would say that's a very good possibility, but doctors remained mystified. And this is when the whole lipid idea, the whole lipid hypothesis became popular. And Dr. Ansel Keys came out with his idea, well, I think it has to do with the fact that we're eating so much fat, saturated fat. And to this day, that's still the conventional wisdom. Nobody ever thought about carnitine. Okay, we are talking ketogenesis, the ketogenic diet and its numerous health benefits. The ketogenic diet is a calm-you-down diet. It's anti-cancer, anti-diabetes, high performance. It's great for seizure disorders, Parkinson's disease. What more do you want from a protocol, an eating protocol? As far as heart health, cardiovascular health is concerned, the heart runs on ketones. Yesterday we talked about all the drugs, the history and the logic or illogic of using cardiovascular medication, statin drugs, and beta blockers and calcium channel blockers. These form the mainstay. These are the primary protocol for dealing with cardiovascular health issues. If you go to a doctor, that's what you're going to get. You're going to get drugs. If he says you got a heart problem, you're going to get prescription medicines. Nobody's going to think about going with the ketogenic diet, which is an amazingly important heart health diet. Ketones are high-powered compounds that all the fast-moving systems in the body benefit from, particularly the heart, the brain, and the skin. And there's also supplements that you could use to support the ketogenic diet. We spent a lot of time talking about carnitine. Carnitine is not only important for folks going ketogenic. Carnitine helps the body utilize fats, but carnitine is also stupendously valuable for the heart. Unlike drugs, carnitine works by improving heart health. Drugs don't work to improve heart health. Drugs don't work to improve any health. That's all you need to know, folks. If you're taking a drug because you think you're going to get better by taking it, all you got to do is understand this. There is not a single drug on planet Earth that will improve your health. Period. End of story. Take that to the bank or to your doctor. There is not a single drug that will improve your health. Oh, they'll improve your markers. They'll lower your test scores or raise them. But they will not improve your health. They cannot improve your health. They're processed as poisons. They require detoxification by the body. That means they are toxins, and it is absolutely idiotic for any healthcare professional to think that leaving a patient on a drug for a long term, for months or for years or for decades, is in any way in their health interests. On the other hand, carnitine works to improve your heart health. It doesn't shut down biochemistry. It improves biochemistry. It upregulates biochemistry. Carnitine, like all supplements, work to improve our health. What a brilliant idea! Drugs do not ever improve our health. They improve statistics. They improve test scores. They improve numbers, but never health. They cannot improve health, even if they lower the so-called risk. There's not a single drug that is not going to have a negative impact on your body. And on top of all that, they cost us nutrition. You're going to burn through your carnitine by taking a drug. You're going to burn through your B complex by taking a drug. You're going to burn through your electrolytes and your vitamin C. And all of that means, by the way, that if you are on a prescription drug, it becomes extra important that you get on your Beyond Tangy Tangerine. You could think of your Beyond Tangy Tangerine as an anti-drug side effect supplement. The Beyond Tangy Tangerine protects you from drug toxicity. The Ultimate EFAs protect you from drug toxicity. Your Sweeties protects you from drug toxicity. All nutrition protects you from drug toxicity. For many reasons, not the least of which is the fact that drugs cost you nutrition. As far as carnitine goes, if you have heart disease, ischemia, angina, heart failure, you've had a heart attack, I would strongly encourage you to be using 1 gram or 2 grams of L-carnitine, or a deluxe form called or called propionic L-carnitine every day. That's propionic, Propionic, L-carnitine, propionic L-carnitine. L-carnitine works too. Propionic is just a deluxe form. There's another form of carnitine called acetyl L-carnitine. This one is really important for the brain. And carnitine is not just a heart health supplement, it's a brain health supplement. Yes, carnitine is important for brain health. And the acetyl form, acetyl L-carnitine, A-C-E-T-Y-L, acetyl L-carnitine, or some folks call it Alcar, A-L-C-A-R, Alcar, is really important for the brain. Alcar is like a natural Prozac. It helps support serotonin. If you're on Prozac, get yourself some Alcar. You may be able to wean yourself off your Prozac. You may not even need your Prozac, and if you do, you'll be able to get. If you do take Alcar, you'll be able to use a lower dose of your Prozac, and that means less toxicity. Supplements allow you to lower your dose of drugs in many cases. Alcar also is epigenetic. It's an epigenetic factor. Epigenetic factors are substances that turn genes on and off. I'm not going to belabor the whole point about genetics and the failed genetic model. Fact is that epigenetics transcends the genes in the sense that epigenetic factors turn genes on and off. And guess what? Carnitine is an epigenetic factor, particularly when it comes to brain health. You know, carnitine is, in addition to being a natural Prozac, it's also got global feel-good effects. We'll talk about that when we come back from our break. I'm Pharmacist Ben. You're listening to The Bright Side on the Genesis Communication Network. Okay, so we're talking carnitine for the heart, carnitine for the brain. If you want to use carnitine as an antidepressant or to improve brain health issues or to improve the symptoms of Alzheimer's disease, you want to go with the acetyl L-carnitine form. That's also called Alcar, acetyl L-carnitine. Carnitine is a fat processing supplement. It's an amino acid-like substance. It's actually not technically an amino acid. It's made up of 2 amino acids. And when you think carnitine, you want to think fats. When you think brain health, you want to think fats. The brain is composed of 60% or so fat. If you're using the ketogenic diet to improve the symptoms of dementia, or if you want to improve brain function in general for memory, creativity, learning, you'd be extra smart to throw in a little carnitine into your daily supplemental program, 1 or 2 grams a day. Carnitine is not an essential nutrient. Your body can make it. But if you have heart disease or you have any issues with fats, if you've had a gallbladder removed, or you're one of the 100 million Americans with heart disease, or you're one of the 100 million Americans who has liver disease, you might want to think about supplementing with carnitine. If you're one of the 80 million Americans who has digestive health issues, if you got intestinal problems, you might want to think about supplementing with carnitine. If you've had your gallbladder removed, you might want to think about supplementing with carnitine. Carnitine is only found in animal foods. Carne means meat. So vegetarians who are interested in supporting carnitine might want to think about getting on a supplement. One of the most important roles for carnitine is in the muscle. If you're a bodybuilder, athlete, if you're lifting weights, carnitine supplementation is something that you want to consider. Muscle uses fat for energy, and one of the signs of carnitine problems or deficiencies in carnitine is low muscle tone, decreased muscle tone, or decreased ability to do aerobic or endurance type activities. Muscle pain with exertion can be a sign that you have problems with carnitine. Cardiomyopathy, remember the heart is got muscle. It's a muscle tissue. Cardiomyopathy is another sign that you may have an issue with carnitine. Muscle uses fat for energy, or I should say prefers to use fat for energy. Sugar can fuel muscle temporarily, and muscle does have a storage department for some extra sugar. When you burn through your sugar stores, your muscles will release some sugar from its storage depot, its muscle storage area. It's called glycogen. But because your muscles are constantly working, it's very difficult for the muscles to depend on sugar as a fuel, and that's why muscle cells have evolved to be fat burners. Fat is stored in fat cells under conditions of high energy, when there's lots of energy coming into the body in the form of food, calories. This is how the body stores energy, and it gets energy from calories, and then it stores it and under conditions of high energy. And this is what most of us are doing. We're getting lots of energy from our foods via sugar, via carbohydrates. All that energy is going to get stored in fat. And under conditions of low energy, that fat is going to get released. That's an important point. This is how you lose body fat, is by stopping the energy input into the body, i.e. fasting and caloric restriction. Or by slowing down the energy input, as in the ketogenic diet. When you eat fat in the ketogenic diet, you're certainly getting energy, but you're getting energy in a slow, sustained release fashion. Under conditions of slow energy, slow, sustained release input of energy, the body has a tendency to burn it more readily than storing it. Under conditions of super high energy input, the body has a tendency to store it rather than burn it. When the body is electrically run down, that is when it doesn't have a lot of energy coming in, or when the energy input is slow, it has a tendency to burn. Just think of your iPhone. When your iPhone electricity, when the electrical charge in your iPhone runs down, it's similar to your biological battery running down. But unlike your iPhone, the body has a backup. That's your fat. Your fat is a backup. And that's a great way to think of your fat. It's an energy backup, and it can recharge you, just like when you recharge your iPhone. Problem is, we get so much energy from our food in this easy-to-absorb fashion, i.e. sugars, that fat we never need to burn the fat. It never gets released. There's so much sugar in the body that not only does the body burn it, it stores it. And then, on top of all of that, you get the hormone insulin. And insulin acts as a storage hormone. And for most of us, because we've been eating so much sugar and we've got so much energy coming into the body, our insulin is way high. Over the course of time, as insulin levels rise, the body stops listening to insulin. That's called insulin-resistance. And so more insulin has to be produced. And this is kind of a cycle that goes on for many of us for our whole lives. High levels of sugar lead to high levels of insulin. The body stops listening to insulin, so more insulin has to be produced. The body stops listening to that insulin, so more insulin has to be produced. Ultimately, the body completely stops listening to insulin, and then you got to take insulin shots. And because of this whole issue with fat and storage of energy, it leads to obesity. Elevated insulin leads to obesity. And this is why type 2 diabetes is a weight problem as much as anything else. In fact, if you want to lose weight, the fastest way to do it is to work with your blood sugar. Not work with your food, but work with your sugar. Not necessarily stopping eating, but reducing the amount of sugar and carbohydrates that you eat. Diet is so helpful for fat loss because under conditions of low carb, the body burns its fat. A couple things I wanted to talk about here. Studies in the news, articles. High-fat diet starves the brain. Apparently, a high-fat diet of 3 days in mice leads to a reduction in the amount of glucose that reaches the brain. And this finding was from a research group in Cologne, Germany. High-fat diet, according to this article anyway, a high-fat diet throws our bodies out of kilter. Interesting. And then they talk about how a high-fat diet reduces nutrition to the brain. And this is a very interesting point because we always talk about the importance, or the benefits, I should say, of a high-fat diet. Well, it turns out, according to this article anyway, a high-fat diet will starve your brain of glucose. You say, well, what's up with that? This points us to the idea of keto adaptation. A high-fat diet supports the production of ketones. A high-fat diet supports the burning of fat over the course of time. And this is where it becomes important to understand keto adaptation. You will get brain fog and headaches, possibly, not always, but possibly, as you shift into fat burning. And this is because, as this article points out, a high-fat diet starves the brain. But what they don't tell you in this article, that over the course of time, the body corrects itself. It adjusts for the amount of fat that's coming into the body. And this is also why it's important to go low carb while you're going high fat. The ketogenic diet is not just a high fat diet, it is a high fat, low carb diet. You can't just do high fat without adjusting your intake of carbohydrates. And yes, over the course, it may take a week or so, or 2 weeks or 3 weeks for the headaches and the brain fog to go away. But you will be happy that you went through this keto adaptation period. Here's a juicy one from the Indian Journal of Endocrinology and Metabolism. Diabetes is predominantly an intestinal disease. I love this. Where have you heard this before? Not your endocrinologist, that's for sure. Not your doctor. Not the mainstream media. Not the mainstream medical model, because they don't treat diabetes as an intestinal disease. They treat it as a blood sugar disease. But if you've been listening to The Bright Side for any length of time, you know that blood sugar diseases, dysglycemia, follows intestinal problems. The microbiome, the gut bacteria play a major role in how the body processes energy. Sugar is energy. You can rest assured lurking behind your diabetes is an intestinal problem. You want scientific proof? Google. Diabetes is predominantly an intestinal disease. Here's another juicy one. The dynamics of human-infant microbiome in the development of type 1 diabetes. Yes, it's not just type 2 diabetes that is an intestinal disease. It's type 1 diabetes also. I got a nasty email from some guy a couple of months ago. I was on George Norris on Coast to Coast, and I said that diabetes is an intestinal issue. As I say all the time, diabetes is an intestinal issue. And this guy wrote me an email. He said, well, you should have made a distinction between type 2 and type 1 diabetes. Type 1 diabetes is an autoimmune disease. He got very upset with me. We had a little back and forth because I said, you know what? Autoimmune diseases are also intestinal issues, which means type 1 diabetes is an intestinal issue also. It's a microbiome issue. This is from the journal Cell Host and Microbe. The dynamics of the human infant microbiome in the development of and progression toward type 1 diabetes. A marked drop in diversity was observed as and this is the diversity of the gut bacteria, was observed as type 1 diabetes progressed. No kidding. We talk about this all the time. The things you hear on this program, folks, the ideas you hear on this program are not ideas that you're going to hear in the mainstream media. You're not even going to hear it in many of the alternative health media either. These are ideas that I've come up with from 32 years of working with patients and 32 years of doing research. And the combination of working with patients and doing with research has allowed me to form a picture of how the body works that nobody talks about. That's what I call the triangle of disease. All disease needs to be backtracked to the gut, and then the blood sugar system, and then the adrenal thyroid complex. All diseases. Tomorrow we'll talk about some more about acetyl L-carnitine in the brain.